People are talking about PrEP, but what is it and what does it do? PrEP means pre-exposure prophylaxis, and it's the use of medication to protect someone from getting HIV. This is important because HIV continues to be a worldwide health crisis. In the U.S. alone, there's an estimated 1.2 million people living with HIV, and many of them do not know they're infected. About 50,000 people become infected with HIV in the U.S. every year. There are lots of ways to stay safe from HIV, and using condoms has been the main strategy for years. PrEP is a new HIV prevention strategy that was approved by the U.S. Food and Drug Administration in 2012, and it's one of the first HIV prevention strategies that can be used by women and men on their own, without depending on their partner. Several research studies have found that PrEP is safe to use and effective at preventing HIV infection. People in these studies who took PrEP consistently, once a day, reduced their risk of getting HIV by over 90%, while those who did not take PrEP were not protected. Lots of new information has come out about PrEP, but we still have a lot to learn. We know that daily dosing, one PrEP pill a day, every day, gives very high levels of protection in both men and women. For people whose only risk for HIV is from anal sex, protection could still be high even if you occasionally miss a dose, because high levels of PrEP concentrate in the rectum. Levels of PrEP in the vagina may be more sensitive to missed doses. Research is looking at PrEP regimens that are less than daily. But right now, the recommendation is still one dose every day for anyone using PrEP. Studies are also being done to determine whether there are any interactions between PrEP and hormone therapy. PrEP does not reduce the effectiveness of birth control, and PrEP is unlikely to affect hormones used by transgender people. Most of the information about PrEP has come from studies of men who have sex with men, and heterosexual couples in which one partner has HIV and the other does not. There will be new studies for PrEP with transgender people and for using PrEP during pregnancy. How does PrEP work? Let's take a look at how PrEP helps prevent HIV infection in your body. Your body's protected by special cells in your immune system called CD4 T cells. These cells normally help keep you healthy when you're exposed to a germ or virus. But when HIV enters your body, it hunts down these T cells, attacks them, and uses them to make copies of itself at a very high rate, as many as several billion copies per day. These new copies of the virus go out into the body and find even more T cells to take over, using them to make even more copies. The immune system just can't keep up with the virus to stop it from making all those copies, and that results in HIV infection. Now let's rewind and see what would happen inside your body if you were exposed to HIV while taking PrEP. Imagine that you start taking PrEP once a day. Your body digests the pills, and the medication starts building up protection for your T cells. Because of the way PrEP works, it builds up faster in the rectum than in the vagina. So let's say you've been taking PrEP daily for a few weeks, and then you're exposed to HIV. As before, HIV tries to attack your T cells, but this time, because you've been taking PrEP, it doesn't succeed. It tries to take over the cells, to make those copies of itself, but it can't, because those cells are protected. The result? No HIV infection. How should you take PrEP? PrEP comes as a pill that should be taken once every day. Because PrEP gets used up by your body, if you don't continue to take it every day, your cells will lose that protection. You control how much benefit you get from PrEP, and that ranges from no protection at all to very high levels of protection. PrEP works best only when you take it regularly, once each day. Taking extra pills will not provide you with extra protection, and it could make you sick. PrEP has been shown to be safe and effective, but, as with all medications, there are things you need to know. PrEP is not a cure for HIV, and PrEP is not a vaccine against HIV. Even taking PrEP every day will not protect you from other STIs like herpes, gonorrhea, and syphilis. PrEP does not prevent pregnancy, but it probably won't cause harm during pregnancy or breastfeeding either. There are studies going on right now looking at using PrEP to safely conceive with an HIV-positive partner and to provide protection throughout pregnancy. If you do get pregnant or want to get pregnant or breastfeed while taking PrEP, talk to your provider about it. Some people may experience an upset stomach when first taking PrEP until their body gets used to it. PrEP should only be used if you're HIV negative. HIV-positive people need more than just one medication to control the virus. That's why anyone starting PrEP must first get an HIV test to make sure they don't have HIV, and they need to get tested regularly for as long as they're taking PrEP. And if they've taken a break from PrEP, they must get tested before starting again. PrEP is not perfect. HIV is a complicated virus, and some rare forms may be able to get around the medicine in PrEP, but it's believed that this is extremely uncommon. Bottom line, PrEP is safe and it works very well when taken consistently. If you do choose to take PrEP, remember how it protects your T cells from HIV, and be sure to take it once a day, every day, to take control of your sexual health. How do you qualify for PrEP? PrEP is an option for anyone who is HIV negative, has normal kidney functioning, and is willing to see a provider every 3 months for HIV testing and STI screening. How much does PrEP cost? Many different factors affect the cost of PrEP, but it can be affordable. Don't let the expense stop you from asking about PrEP and finding out what it would cost for you. Where can you find out more about PrEP? The best thing you can do is to talk to a healthcare provider.